The Ebola patient at Presbyterian Hospital in Dallas is the first person known to have brought the virus to the United States on a passenger plane.
The Centers for Disease Control and the Texas Health Department has been assessing people's concerns over who may have traveled last Friday and Saturday when the patient was on his way from Liberia to Dallas. Fox 4's Brandon Todd at DFW Airport with more. Brandon, so we're not talking about 4 days ago Friday and Saturday. We're talking about a week ago Friday and Saturday was the travel, right?
Yeah, exactly, and the time span here and all that has to be taken into consideration as well. I mean, since the terminals here at DFW Airport are in Tarrant County, that means the Tarrant County Public Health Department is in charge of any investigation that centers around infectious diseases. This afternoon, health officials from Tarrant County have been trying to address this Ebola case and answer questions as to whether it had any impact on travelers.
I really do want to emphasize the focus here over the next period needs to be the patient, and we're very focused on trying to get any assistance we can to the patient who we understand is critically ill at this point.
But as officials begin to focus on that patient, there are questions about whether anyone who flew with, next to, or around the patient would be infected.
In terms of the flight, I understand that people are curious about that and wonder about it, but remember, Ebola doesn't spread before someone gets sick, and he didn't get sick till 4 days after he got off the airplane. So we do not believe there's any risk to anyone who was on the flight at that time.
DFW airport officials have deferred to the Tarrant County Health Department. The Tarrant County Public Health Department has deferred any statements to the CDC and Dallas County Health, but they have reiterated that they believe there was no risk to airline passengers. Since the CDC has not confirmed or released any details about the Ebola patient's flight plan, it's only an assumption right now that he may have come through DFW Airport. But health officials stress if he was displaying signs of Ebola, he wouldn't have been allowed on the flight anyway.
One of the things that CDC has done in Liberia, Sierra Leone, Guinea, and Lagos is to work with the airport's authorities. So 100% of the individuals getting on planes are screened for fever before they get on the plane. And if they have a fever, they're pulled out of the line, assessed for Ebola, and don't fly unless Ebola is ruled out.
And American Airlines told me in an email today that that Ebola patient was not a passenger of theirs. Steve?
All right, Brandon, you know Zach Thompson's in studio tonight, so you've been talking, I think, with the Tarrant County health officials, his counterparts. What's their take on this Ebola popping up in North Texas?
Right. Well, you would certainly think that they maybe are breathing a sigh of relief that they sort of dodged this one, but they aren't treating it that way, or at least they aren't acting that way. They're meeting just as they would as if it were happening in Tarrant County. They'll be meeting tomorrow the same way. People taking a really kind of an active stand on this. Getting together, trying to crunch information just like Zach is doing there in Dallas. They're doing the same thing in Tarrant County just to make sure that that nothing does impact the folks over here in Tarrant County as well. Hospitals doing the same thing, meeting with their staff and all that tomorrow morning as well. Steve.
All right, Brandon Todd, thanks.